Back surgeries have come a long way. Today we are joined by Dr. Stovall from Lowcountry Orthopaedics. Thank you so much for joining us today. Tell us a little bit about disc replacement.
Well, most people are familiar with the joint replacements that we perform for hip and knee problems. They've been around for many years. The disc replacements are relatively new. This involves removing a damaged disc from the spine and replacing it with an artificial disc, usually made of a metal such as titanium or a metal and plastic combination.
Can you show us what a disc replacement is used for?
Well, the bones in the spine provide the protection for the spinal cord and the spinal nerves. The discs are the cushioning in between the bones, and they provide the movement or flexibility in the spine. If you have a damaged disc, either from a disc bulge or a disc rupture, or wear and tear over time, it can cause pressure on the nerves. That can cause symptoms such as headaches, neck pain, back pain, arm pain or leg pain, and numbness in the hands and feet.
Tell me a little about patient expectations once they receive a disc replacement. What are the expectations in terms of, are they back to normal pretty immediately?
Well, generally the surgery takes about 2 hours. It can be done as an outpatient or an overnight stay in the hospital. The general recovery is about 4 to 6 weeks. We like to get patients moving right after surgery. They can move their neck or their lower back immediately after surgery. Usually by about 3 months they're back to fairly normal activity, including sports.
That's great. That's great. So this is life-changing.
Yes, we've had patients that have returned to professional athletics, police and firemen. We had one patient that was inducted into the South Carolina Hall of Fame for bowling after having had a disc replacement.
That's great. So if you're experiencing back pain, and for more information about back surgeries in general, log on to www.lowcountryortho.com or give them a call at 843-797-5050. Thank you again, Dr. Stovall, for joining us. We appreciate your time.
My pleasure.